I think reform has done a terrific job of ringing the bell for how seriously broken the American healthcare system is.
The primary driver is very clearly the potential for financial penalties and also the move from a fee-for-service model to a value-based care model. And in these models, provider organizations like Northeast Georgia Health System are going to bear some financial risk for the outcomes that they deliver. They also bear some financial risk for health care that's provided outside of the context of the system because of the central acute care organization within this geographic region. So it's important not only for Northeast Georgia Health System to better utilize the data they have available to them to manage populations of patients with like condition and individuals, but also to work with the data from their partners through the health information exchange or other relationships so that they can have a broader view over the continuity of care and try to manage particularly that 5% of the population that is driving roughly 50% of the healthcare expense.
We have operated without having really good data, and we've been getting paid for as many procedures as we could crank out and as many patient days and that's not a sustainable model. It's not a model that you find in any other developed country in the world. And organizations are initially, especially because of the HITECH Act, slamming in EMRs as fast as they can get them in so they can start collecting the data. That's why analytics is probably at the peak of inflated expectations right at the moment, because now there is data and now we really need it to be able to manage our business, manage the care the patients get, manage the continuum and all that.
We have struggled for many years with the idea that we ought to have evidence on what we should be doing and doing better. The problem has been obtaining the evidence. The cost of that itself has been monumental. But because of the progress over the last 3 years in electronic health record implementations, the ability to capture the data digitally and make it available to analytics engines has really accelerated the basis of the evidence that will inform transformation.
Our belief is that better data, appropriately used, leads to better outcomes. Data appropriately used will make the cost of care lower. And while a lot of that's covered by insurance, as we move forward into different types of employer plans, and the health exchanges are opening up in October that are high deductible plans, some of them, more of that's coming out of the patient's pocket. So they should take an interest, more interest than they've taken in the past on the actual cost of the care. But most importantly, are you getting a quality outcome?
But if you combine the analytics that could be made possible by companies and the work that they're doing, and you combine that with the capabilities at Northeast Georgia and the ones that are growing as Northeast Georgia comes up the maturity curve, that says at the community level, Northeast Georgia could do things that improves the health of the workforce. A healthier workforce is a more productive workforce. A more productive workforce attracts companies who want that kind of talent because it's so important to them as they look at their kind of future. So there's this opportunity to combine business analytics and healthcare analytics in order to improve the economic well-being of communities like Northeast Georgia.
A lot of health systems are really struggling because it's not necessarily a function of implementing some more software and some more IT to get in the way. It's a function of changing the culture of an organization. And to be successful going forward, you're going to have to be data-driven. And you're going to have to execute on some change management strategies to get people not only knowledgeable and able to use the systems, gathering the correct data, being able to analyze it, but have the willingness to do it.
You know, a leadership challenge for the hospital system is to help educate the entire population, all clinicians, everyone that has the potential to put data into a system, to see to it that that data goes in accurately, it's timely, and that they have a sense of what the value and impact of that information is, not only to the outcome of the patient, but also to the operational and financial performance of the hospital system.
when you put in an information system like an EMR for a healthcare organization, there are a bunch of people that you can train all day long, but they aren't going to do it just because they don't want to, because they don't understand the value of it, and they don't understand how they fit or any of the rest of that. The analytics piece brings that home for them, because now, okay, now I can manage my patients better, and now I get better outcomes, and I know why I need to change. I know why I need to enter this information, and it needs to be clean. You all are quite a ways down that road, and I think you're doing a remarkable job.